Welcome to Health Systems CIO's interview with Terry Grogan, VP of IT Assurance and CISO at Tower Health. I'm Anthony Guerra, founder and editor-in-chief. Terry, thanks for joining me.
Hey, thanks so much, Anthony, for having me. I really appreciate the opportunity.
All right, very good. Thank you. All right, Terry, let's start off. You want to tell me a little bit about your organization and your role?
Sure. Tower Health is a three hospital health system. We also have, in addition to Reading Hospital, there's Phoenixville and Pottstown Hospital, and we also have a joint effort with St. Christopher's Hospital for Children in Philadelphia. We have about 18,000 users. We have community connect sites. We have medical groups, specialty practices. So it's a typical mid-sized healthcare system. And I am the Chief Information Security Officer here for all of Tower.
All right, excellent. Thank you for that. Let's start open-ended here, Terry. What's on your mind? What are some of the trends you're looking at, things you're watching, just sort of top of mind stuff, and we'll go from there.
Sure. Uh, as I'm sure you're aware, if you've talked to any other healthcare CISOs, we are a very targeted group of entities. Uh, I constantly watch the news and see my peers deal with attacks. I look at our logs and see us being attacked on a daily basis. So I have a lot of the same attacks that others look at. Phishing, obviously a big one. But interestingly, we're getting a lot more attacks that are hitting us for ways of getting a hold of folks outside of normal phishing email, which seem to be not as effective anymore for threat actors. Impersonations have been a big problem for me recently. And we have upped our identity questions when we try and positively identify folks for password resets or especially for changes to their multi-factor authentication. We've caught several threat actors impersonating physicians. In addition, we're having a lot more attacks to reach our patients through spam phone calls and spam emails to our patients impersonating us, trying to do identity theft. I can't do a lot about that other than to try and warn our patient community, but business risk, business compromise, positive identity of people are two of my biggest things on top of mind. And of course, zero-day attacks from our business partners uh, are obviously a challenge.
Yeah, lots of stuff there. We're going to go through a number of things you just mentioned, but you mentioned looking at the logs. I haven't talked um, in depth about logs a lot with people, but I know it's extremely important. Can you tell me more about proper handling of logs, use of logs, how they come into play in doing your job well?
Sure. Again, here's an area where we step up our game. So we started out with the kinds of logs that most people do, which is the logs that you get on your endpoint protection products. And I think that that's a pretty standard place for most people to look, and still a very important place. What's happening in our endpoints. But we also look at key alerts from firewall logs and key alerts from network traffic, as well as key alerts from our cloud-based applications. And so right now we send those logs, mostly the key alerts from them, which we tweak often. So it's not tons of the raw log, but it's key events that we look for to a SIM, to a consolidation place, and then look for those events that might show a correlation. Looking for lateral movement, looking for command and control, impersonation of users, escalation of privileges. And you need multiple log sources to stitch that picture together. It can't be just what's happening on the endpoint anymore. A lot of it now happens through disguised as normal access. And you only are going to catch that if you look at a history of the life of an activity to see that it's not normal access.
Hmm. Okay, so it's sort of you're gathering information from multiple places about things that are going on and also things that indicate attacks, and you're trying to piece this all together to get a picture, sort of pattern recognition to see what's going on, correct?
Yes, and I think from our perspective, user behavior analytics has become much more important because it's rarely the user anymore. When it's malicious, it's someone who's compromised a 0-day activity. Yes, we still have threats of somebody downloading a malicious piece of software from a bad internet link. But when you look at the types of attacks that have hit people, it has been an account that has come in usually through some weakness that was found, whether it's a 0-day or an email or an impersonation. But then that normal account, that fake user starts doing things that are not good behavior for that user or for that device in some cases, but for that user. So I think it's more important that you stitch together activity and start looking for abnormal behaviors for an account as opposed to a point in time activity.
Absolutely makes total sense. And we did a webinar on this recently. The idea is that it was sort of two scenarios we went through. One is where a user's credentials are compromised. They give out their credentials, they get tricked. In one scenario, they realize it and they go, "Oh my God, that something happened," or afterwards you realize it, and then ideally you notify IT and you say, "Hey, listen, I'm so sorry, I made a mistake. I think I did something bad." So that's scenario A. That's fairly manageable because now you know and you can deal with that. Scenario B, I think, is what you're talking about, which is I got tricked and I don't even know it. So I'm working, I got tricked. They gave out my stuff. I thought it was a third party vendor or accounts payable. Somebody asked for my stuff and I don't know, so I'm not alerting anyone. Now you have someone in your network using the credentials. You're talking about pattern recognition, user behavior recognition. So you know, and you say, Jim never is in that system. Jim never logs on at 3 a.m. Jim never logs on from Belarus. so, so am I on the right track here?
You are. The challenge we have in healthcare, of course, is the Jim never logs on at 3 a.m. because healthcare workers could be working any shift. And we all have read and know about the burden on physicians nowadays to keep up with their patient load. So we have physicians working in their pajamas all the time and in the systems. So that one is tougher to crack as in healthcare as to this seems to be an inappropriate amount of time. So we tend to look for more of the other things, location-based access. Jim doesn't ever log in from California unless he's on vacation. Why is he on vacation? Should he be? Especially if he logged in from California. Now he's going to a server and downloading a lot of files, and he normally never does that. So we are doing more of trying to correlate multiple things to look for some of those because we can't easily say, well, you're a first shift worker, you're only in on first shift and you only work when you're on site. Uh, COVID is what it is. We still have tons more people working remotely than ever did before. Folks work on vacation. So we have to be careful
Hmm.
of some of that, but we try and match multiple events together.
Yeah, and that makes a ton of sense. So you can't be out there with all these false positives, annoying Jim every couple days because you've got these false positives. So you have in healthcare, especially when we're talking about physicians, that's not going to work, right?
Right.
Yeah, yeah. And the other thing I spoke to someone about the other day is this concept of if there is an issue, getting people up and running and back to work as quickly as possible. So if there's a credential compromise, yeah, okay, something happened. but there's an important time element there to get that person working again, correct?
Correct. And that I have to say that that's not been a challenge for us. We have playbook processes. Folks still click on bad phishing email links. Even they're pretty good here. They do a pretty good job of not doing it, but they still do. People, the phishing emails are better and better. They're much more written. Some people say by AIs who try and make sure they're targeted to you and seem more personal, and folks click. So we have a pretty good playbook, whether it's reported or we just believe it because we were notified that you clicked on something malicious, that we can run folks through and get them changed with their credentials back in, their accounts cleaned if necessary, in a pretty fast order. And I feel pretty good about that. And because of that, I believe our users have gotten much more willing to tell on themselves,
Mm-hmm.
because we make it far less painful, I believe, for them to get back into systems and be back into working and functioning.
And that also requires sort of a no punishment, no judgment approach, right?
Correct.
It can't
Correct.
be a slap on the hand because people will avoid the slap on the hand. So tell me about how you create that culture of, yeah, we want you to be as super careful as possible. Yes, a mistake has been made. You made a mistake, but it's okay.
Correct. So a couple of things. We of course try and build systems that make it easy for you to do the right thing and hard for you to do the wrong thing. So for example, unfortunately, it's way too easy to click on push notifications for MFA, even when they're not from you. So we are moving folks to passwordless so that they see 2 digits, they don't see a push notification. So almost none of our apps are push anymore. So it's hard for you to do the wrong thing by letting a threat actor in through your MFA, because you can't just click yes, because
Uh,
you have to be able to type the 2 digits and you can't see the 2 digits. But because we're going to passwordless, I now make it very easy for you not to worry about your password, because you put your email in, you just ask for 2 digits. So I try and make it easy for you to do the right thing and hard for you to do the wrong thing. On the other one, when it comes to repeat offenders, I get asked this question by some of my peers, which is interesting. Well, what do you do about repeat offenders who click on email? Nothing. I encourage that, nothing that they see. I encourage them. We have a quick chuckle. I help educate them to understand what they potentially missed when they did it. But frankly, what we do is in the back end, I'll put that user into browser isolation going forward, so that I try and make it harder for them to compromise themselves again. Here, we do a very heavy campaign about report it. The see something, say something from back in my era in the military, because if you report it, and this is what I teach users, and we do contests for users reporting, being the first ones to catch our phishing campaigns and that type of thing on an annual basis. But if you report it, you remove it out of everybody else that received it who might have been too busy and didn't pay attention and click. You saved your fellow employee. It takes a village. So we do nothing punitive to users who make a mistake.
yeah, I mean, I'm not going to ask you to get into mind reading here, but the scenario I laid out where that sort of, there's a scenario I laid out, which is I gave out my credentials. I think I did something wrong, but I'm scared. So I'm not going to tell IT because I'm just going to hope nothing happens. You'll never know that, right? So with the person who had that realization, you'd love to have a different talk with them from the one who didn't realize it, but you'll never know. So you just got to do the best you can, right?
Correct.
Yeah.
Correct.
Let's talk about automated versus manual. Some of the things you're talking about, it's hard to tell if there's automation that gets you to a certain point, and then maybe there's a culling of sort of pings, and you say, okay, guys, look at these five. We can't look at the 500, but let's use technology to get us down to 5, and then let's manually look at 5. Just tell me where and if automation comes into any of this to make your lives easier.
Automation does come into some of the macro filtering. So we tweak major systems like the system I have that monitors network traffic. We tweak constantly some of the alerts we look at in there around what are we seeing, what's an anomaly, and AIs have gotten better at this. So we do automation enough to weed out a lot of the macro noise, but I don't have it tweaked so much that I potentially miss an item. So we still have more false positives than I would like. But I've taken the stance of let me hire people who do this for a living. So we do outsource to a third party managed service to look at our alerts.
Mm-hmm.
They look at what we've filtered down and we partner with them to look at what goes into the SIM so that they look at all the things that came in there and filter out true false positives. So they do the first pass at manual labor to say, yeah, this really wasn't anything. It was okay. And if we learn enough by enough of these false positives, we can tweak again and not reduce our or not increase our risk of missing something, then we'll reduce. So it's constantly a tweaking program. But I believe that for right now, we are not in a place where I can automate everything. And I will right now, if it's a high risk, what I do automate is on the side of caution. So I'll lock a machine or a user out with an automation based on hitting certain rules. Whether I'm wrong or not, it doesn't matter. I'd rather say, I'm sorry, I didn't mean to lock you out, than to not have taken that quick action if it really was something important. So very critical rules we automate on the side of lock it and ask for forgiveness afterwards.
Very good. Makes sense. There was an article in the Wall Street Journal, I think yesterday, about Change Healthcare. Two of the things they said, or they said that the attackers were in the system probably 9 days before they did anything, which is fairly short in healthcare. We've heard about them being in months, for months, but I guess they figured they needed sometimes they're ready to go because they're afraid they're going to get kicked out, whatever the case may be. I think the bigger point is that they said there was no MFA on that had something to do with the breach, that there was not MFA on the system that was breached or the account. And that goes back to cyber hygiene. In so many conversations I have with people like yourself, it's like so many people talk about just the importance of the blocking and tackling, MFA being a core piece of that blocking and tackling. You really don't want to get breached and have it be for blocking and tackling. Tell me your thoughts about that.
And that's a great comment to have as a general. Uh, Absolutely. We require, and you ask what's my standard, we require MFA remotely, period. What's reality? Reality is that I still deal with partners where they may be the support vendor for a major system, like maybe a major biomedical system. And they may have hundreds of people. So today, I don't have hundreds of their technicians built into my system so that I can MFA them in. So that's a challenge. How do you handle it? Now there are projects out there, and I am looking at those. Everything in security costs money, and you have to balance risk with business cost and business need, especially as you're still in a change around. So right now, while I am looking at implementing a project that gets vendors off my network, and while change hasn't told us what account got in and where and why, it would not surprise me to find out that this wasn't a support vendor account that was a generic account, and you can't MFA generic. I don't know that for a fact, but I know that's a weakness in a lot of places, including here. I have to say, how do I handle it? I have very few generic vendor accounts, but I have them. Now, I do handle them a little bit differently. They are disabled here. So while it makes it unhappy for my application owners who own these applications that need a generic for support, we have a process in place that says if you need a vendor to fix a system and that vendor has a generic account, that vendor, you and the vendor talk, you call my service desk, you give them a piece of information that we have, and then we unlock that account for 24 hours. Change the password afterward. If you need it more than 24 hours, we give you the new password. So right now, that's the way I'm handling an account that doesn't have MFA that's remote. I'd love to say that I don't have a single account like that, but I do. And so that's how I handle it until I can get vendors off my network and let the vendor be responsible for MFA.
Well, a lot of great stuff in there. So what, at a high level, what you're doing is what all great CISOs are supposed to do, which is find points of unacceptable risk and do something. You're not going to get it to zero, but right, it's you could picture a chart on the wall with bars. This one's too high. I don't like this one. This one's red and the bar's way too high. What are we going to do? I'm not going to get it down to the bottom, but I need to get this down 30% for me to be comfortable. So let's meet, let's talk. And you know what? If there's a little unpleasantness on the business side, Mr. Business User, you don't want to have to, you want to just them to just fix it. Well, that doesn't work here. You're going to have to do this password thing. You're going to have to communicate because I got to get this down 30%. This cannot stand the way it is. Correct?
Correct.
So
Correct.
you work through that.
Yeah, you have to find a security control that helps you reduce risk to an acceptable level and yet still lets the business run.
Yeah. So you're taking the stand that this unpleasantness is the price we have to pay. So sometimes it is going to be a little interference in your workflow, but it's going to be as little as possible for as short as possible, but it's going to be something sometimes. So the business, that has to be a conversation that the business has to understand from you communicating. Listen, I don't love doing this, but this is the best we've come up with to get to an acceptable level of risk. And that's that. And that's where you need backup from your CEO for when that business user, if they go run and they say, hey, look what Terry's doing. This is ridiculous. The CEO has to be ready with a response that says, I talked to Terry and here's why this is being done and have support, right?
Correct. And I think that this is why I think it's why it's very, very important that you have a risk register, that you talk about what are the major risks, what are the major controls in place, what's the residual risk from that, because this falls right into identity management and access. And so here's where risk is, here are the controls in place to reduce the risk. And an agreement around we're okay with those controls, we're okay with the risk level where it's at, or no, we're okay with it being higher, no, we want it lower, or we don't like this control. Okay, if you don't like this control, I can make it this way, but here's what it will either cost you in dollars or cost you in staff time or cost you in a change in workflow. And so that you and the business have a conversation so that everybody so that they are making informed choices and informed agreements, that they understand that we have to do it this way because to do it another way is $500,000 a year and we don't have that right now.
All right, so here's an interesting question, and I would bet many CISOs have had this feeling or dynamic. What do you do if you've done everything the right way, meaning you've explained the risk scenario, and let's say it's a risk scenario you're extremely uncomfortable with, and your advice is this is too high a risk. You've explained it as you can, and the business, whoever that may be in this case, says, we will accept the risk. Now, that's how it's supposed to work. You're
Correct.
supposed to say, okay, you've accepted it, maybe document it, whatnot. Now, in reality, if there's then a breach and you get fired for, let's say you get fired, now that's on your resume. You got fired, they had a breach. For the rest of your career, that's on your resume. Not everyone's going to be there for the conversation where you get to explain what happened. My point being, I'm sure many times, and I'm not saying this is a case where you work at all, not my point. My point is that what do you do? I guess you find a new job. If you're a CISO being told to take on a level of risk that you just are not comfortable with.
So yeah, so and maybe this is just because I've been around a little while. I don't worry about that. Here's the point. We could get all the risk down to everything that we all agree was acceptable, and they could agree with everything that I said. Give me all the money I want, all the staff I want. I have a cush job because I get everything I ask for, and we could still get breached. 0 days happen. I can never tell them I'm protecting you from the thing you don't have because that we don't know about.
Hmm.
So containment, we have to be ready with containment. So if I say, here's where the risk is, and I'm saying that we all agreed that here's our dotted line on risk. This thing is taking us outside the dotted line. I think we should lower it. And here's my recommendation on lowering it. And the business says, we hear you, Terry. That's great, but we're not willing to do that right now. We're going to buy that thing that you think is terrible for us to buy, or we're not going to buy this product you need, or we're not going to change your workflow, or whatever. We're just going to accept the risk. We understand it's outside, we're going to accept it. All right, what do I do with that information? Then I come back and I say, fine, we document that we know. I come back and sit down with my staff and say, all right, what do we monitor since we know this is a higher area? Do I change up my monitoring controls? Also, let's assume I lose it here. What's my first containment? What do I need to be aware of that says, if this is breached because we accepted this risk because of this process, how do we contain here? Where is the likely scenario to happen for this? So I up monitoring, I look at containment, and we just add this because it's our higher area. Just think about it today. You add higher controls in your areas of highest risk. So this has now become an area of highest risk, because a higher risk because I didn't put the control in, or I couldn't, or we bought the thing, whatever the reason. So now what do I change differently? How do I focus it better?
And I think that's a perfect answer. And I think that's exactly the best advice for people who are in that situation, to just sort of deal with that elevated risk in a positive way and do the best you can. So that's a great answer. Makes a lot of sense. We're almost out of time. I do want to ask you something else, based on your experience. You have unique experience. You were in the military. You were a drill sergeant. Um, and so the question is this. Um, some people assume that leadership in the military is easy because people sort of have to do what you're telling them to do because of rank. So I don't need to convince you. It's easy in the, well, if I could just be in the military, if everything was like the military, the people that work for me would just do what I tell them because they'd have to, because they could get court-martialed or whatnot. But from everything of all the people I've talked to and everything I understand, that's certainly not the case. Um, even where situations where there are situations where people are commissioned, young people out of college, right? And then they become in charge immediately of people that have 10, 15 years of experience. And if they don't handle that relationship properly, I guess it's this, is it the sergeant, the people that ultimately wind up referring to,
Correct.
they will almost ensure you're not successful, right? So it's not true that you're sort of out of the woods if you're in the military. I would like your overall thoughts on that concept and what the military taught you about leadership and your best advice to your colleagues about leadership.
So yeah, that's a great question. I mean, it's funny. I got my first job in healthcare IT because I was a drill sergeant. Because the CIO that hired me thought that he needed somebody who would beat the guys into submission. And people will, even in the military, people will adhere to your leadership because they have to, because you're in the chain of command. Just like in business, you're the boss and people will. But people will do that when life is normal and following normal path. When there is a crisis, people follow the people they trust. It's that referent power where I'm adhering and following your authority because I trust you, because you built that relationship with me. If we're in crisis, I'm listening to you because I really do believe you have my best interest at heart. And so when I look at security as a CISO, yeah, there are people who are going to do what I say because I wrote the policy or I turned on the technology. But people are going to admit they clicked on the link, or people are going to tell me that the pop-up that came in and said your computer, that we've got such a rash of those lately. Your computer has been infected with malware. Call this number.
Mm.
And they do because they're panicking, and they actually even tell some threat actor that they'll put any desk on the PC. And then they start and go, I don't think this is right. They'll tell on themselves because they know that I have their best interest and they know I'm not going to punish them. That doesn't mean people don't get punished. People get punished when people do things that no reasonable person should be doing. That's an HR thing. That's not my area.
Mm-hmm.
But people trust that I have their best interest in heart. And that's what a CISO needs. A CISO needs to get referential power. They need folks to give them that authority because folks believe that they are knowledgeable and they have their best interest at heart.
All right, Terry, I think that's all I had for you today. Maybe any final piece of advice for your colleagues based on your experience that you think is one of the keys to your success?
I have no follow advice. I will say kudos to all of you out there in the trenches doing this. I think we all have to be a little crazy to be willingly in this job. You're always fighting an uphill battle, but it's a good fight because we do good things. And so I try and focus on why am I in this job? I'm in this job because I think I'm making a difference.
Right. All right, Terry, thank you so much. I really appreciate your time today.
Thank you. And thank you for inviting me.